The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone, and thank you for attending today's educational webinar. Today's topic is EHR Transitioning. Before we get started, I'd like to just remind everybody that your computers are muted. If you have any questions during the webinar, feel free to type them in using the GoToWebinar tool. When we get to the end, all of the panelists here will be happy to answer the questions in the order in which they've arrived. So let me go ahead and introduce our three presenters here. We have Steve Rhodes, the CEO and founder of Physicians Trust. Physicians Trust is a channel partner with e-ClinicalWorks. We have Mark Roberts, the CEO and founder of Vermetis, who is also a channel partner with NextGen. And then Richard Sweeney, who's a senior manager with athenahealth. All three of these companies are exclusive members of the Physician Resource Center. And we're very happy to have them available today to present with this topic. The next slide I'd like to show you is the premise of the webinar. I'll go ahead and read this. A survey by Black Book Rankings found that 23% of practices with EHRs are unhappy enough with their current system to switch to a new system or vendor. Subpoints below, but when and how do you move from being dissatisfied with your EHR to replacing your entire system? And how do you ensure that your next EHR meets your practice's current and future needs while avoiding the deficiencies and limitations that impede your day-to-day operations? So with the premise being set, that's what we'll be talking about from these three different vendors, and I'll go into the topics that we'll be covering in just a second. Before we get before we get started on the poll questions, the sections are infrastructure, which Steve Rhodes will cover, conversion needs, and then choosing a vendor. So we'll separate out each section for each participating presenter. The poll questions I'm going to throw up real quickly, if you wouldn't mind answering, and just pick the best answer that applies to your practice. First one, how long has your practice been using an EHR? Less than 12 months, 1 to 3 years, or over 3 years? So you go ahead and select which option is most applicable to your practice. We'll close this in about 10 seconds. Okay, we'll go ahead and close that poll. Here comes the next one. And we'll share these answers at the end of the webinar. The next one, are you considering switching your current EHR? Options there are yes, no, or I don't know. We'll keep that open for another 10 seconds or so. All right, thanks for putting some information in there. And here comes the last one. How confident are you with your vendor's readiness for industry changes like meaningful use stage 2 or ICD-10? Yeah. So jot an answer in there, and we'll keep that open for another 10 seconds. Okay, all right, wonderful. Well, thank you for voting on those. We'll close the poll, come back to the screen. We'll move over here. Steve, thank you very much for presenting the infrastructure section of today's webinar.
Thank you, Dustin. Good afternoon, everyone, and thanks for attending the webinar today. I'm going to be tasked with giving you an overview of the infrastructure needs that you need to consider before switching EHRs. It's a topic that is usually not covered by your vendors, but it can be very important on the total performance of your organization and that EHR platform. So, Dustin, if you go ahead and move forward, or am I driving here?
I'll go ahead and drive the ship for you.
Okay. So the first topic we're going to discuss is where does your new EHR reside? The prevailing trends in the industry today are moving towards the cloud or a SaaS deployment model, to where your EHR platform actually exists at a data center, whether it's a third-party organization or the vendor itself. So we're going to discuss kind of the pros and cons of that briefly and give you some ideas of things you need to be aware of. So when we move to the cloud, there's a few pros that we want to point out. It is traditionally a fixed monthly expense, so you don't have any surprises with a server going down or upgrades you may need to do on a local device in your office. Your backup, your encryption, and your maintenance, as well as your disaster recovery, are all managed by your hosting center. So again, that gives you the peace of mind as mentioned in the bottom. That's really where you're going to see some cost savings from a hosted model. It is scalable, so as opposed to on a local server, if you're going to be storing more images, x-rays, pictures, things like that, you need to add more memory. Your data center is easily scalable, and if they do charge, it'd be a monthly expense traditionally. As I mentioned at the beginning, peace of mind in having your data stored somewhere secure. If there was a flood, an earthquake, things like that, you could quickly reconnect to your data center. The cons of moving to the cloud is you're really dependent on your ISP. It is the single point of failure traditionally in a hosted environment. And we're going to talk a little bit more about connectivity as we get into this presentation. The other thing I point out about moving to the cloud is understand your exit strategy needs. Make sure they're well defined in your SLA or your service level agreement, so that if in fact you elect to move to a new EHR, retire your business, or sell your business, you understand what the cost may be from that vendor to get out of that hosted environment, what it may take you to get a copy of the data, or what you may need to pay to leave the data there for an extended amount of time for a reference point. So those are things you want to consider when you're looking at moving into the cloud from a local server environment. Dustin? Legacy data storage. Again, this is a topic that's traditionally not discussed much as you look to move to a different platform. But one thing you're going to have to remember is you do have data that exists today in your legacy EHR. And you're going to need to access that data, whether consistently day to day or at some point. So where are you going to store the data from your old system? Are you going to leave it in your network, in your internal network on a server? Are you going to move it to the cloud? Or is it existing in a cloud today? And how often will you need to access that? Most practices transitioning to a new EHR are converting some data from their existing system. It may be simple demographics conversion, or it may be more detailed clinical conversion. If you were going to leave any data in the old system, you're going to need to have a secure access to that. And when we talk about security, we talk about HIPAA and the meaningful use security risk analysis. Is that data secure if it's on your premise? Do we have limited access to that data? Is it protected from someone downloading or printing from it? Is someone else accessing it, like a third-party vendor, say a revenue cycle management company? So even though you've moved to a new EHR, you have to address what you're going to do with your old storage for med-legal reasons and for your own access reasons. The other thing I like to point out is meaningful use. Since we're now in our fourth year, we'll call it a meaningful use as we transition into 2015, most of the folks that have attended this webinar have begun at least their attestation period for stage 1. They may have attested 2 years on stage 1 on the EHR they'll be replacing. So one thing you need to bear in mind, if you are audited this year, next year, or into the future on your previous attestations, and you have to produce reports documenting the information you gave to CMS, will you be able to do that? If you've shut down your old EHR and you don't have access to it anymore, you're not going to be able to produce those reports. So remember, even though you're converting to a new EHR, the legacy data will still need to be accessed. So you need to have a plan of action to be able to do that securely and protect that data ongoing. Dustin? Connectivity. We spoke about this earlier in the discussion of the cloud versus local server. And as I mentioned, the internet connection is your single point of failure traditionally for access to the cloud. The most important thing you want to do is work with an ISP, an internet service provider vendor in the area that's going to guarantee you speed, latency, and reduced packet loss. You want to ensure that your speed is consistent both ways. When you first move to the cloud in a traditional environment, you're downloading information from the internet. When you move your EHR to the cloud, you're going to be uploading the same amount of information that you download. So you want to have synchronous speed times. You want to ensure with your vendor, again, look at your service level agreement with your vendor on how much latency you can expect and how much packet loss. And that's the details of information going back and forth, getting interrupted. What that'll do is cause delays in the performance of your EHR. So you need to lock this down with your vendor and, again, have guarantees in the agreement. You're also going to need routers. If you're in the cloud, you might be looking at a wireless environment in your practice as well as a router directly throughout the practice. If you're a local environment, again, you're going to be managing that network, so you're going to need that router control. Most EHR vendors may use a VPN. If they're not a pure app that sits on the cloud like a Google, they might have some sort of connectivity or some sort of image on your local machines, and so you're going to be using a virtual private network to communicate back and forth. Just recognize the cost of that. Understand from the vendor if you need a static IP or not, because these are things that will slow down your implementation. And finally, I always talk about remote access and security. If you move to the cloud or you change EHR vendors, who else is going to need access for that that's outside of your office? Are your providers going to want access remotely from home or on vacation? How do they do that? Is that some sort of remote desktop connection? Is it a local tool on a desktop like a LogMeIn, or is it something through your data center? So plan for that. You may have a revenue cycle management partner that's connecting directly into your technology. Again, plan for that. And then from a security standpoint, make sure that anyone who is connecting to your EHR has a HIPAA BAA in place with you. The only other thing I'll point out about connectivity, if you are running a voice over IP system, a phone over the internet, ensure that you communicate with your vendor about that, because that can impact your bandwidth needs. Dustin? All right, the internal network. And what I want to cover in this slide is the end user experience, or more importantly, how do you engage the patient? So how do you design that office for your new EHR from a networking standpoint? So if the provider is engaging the patient in the exam room, are they going to be using wall-mounted PCs, wireless tablets, laptops they carry back and forth? So is your exam room jacked out with proper internet access, or is this something that you're going to have someone come in and pull cable for, because those are costs associated with that? The same question for your clinical team, your MAs, your RNs, your support staff, and that methodology. Are they looking to set up a network to where vital stations, diagnostics, spirometers can be interfaced into this new EHR? And is that an interface, a Bluetooth interface, or a hard cable interface? So again, as we look at our internal network, where are we going to have to run wires and ensure that we have the proper connectivity? Same concept with our administrative team and our financial team. As we look at networking, where are folks going to need to print, scan, generate reports, potentially patient pictures in the new EHR? So these are things you may not be doing today in your existing legacy technology that you need to plan for tomorrow and ensure that you have the proper connectivity, so that when you go live on that EHR and your provider wants to print a visit summary, everyone knows where that goes and it comes out cleanly. Okay, Justin? Our hardware, our computing hardware. So this is the data entry and retrieval tool from our new EHR. And I want you to think workflow. Where are we going to place these devices, and what type of devices are they to optimize our workflow? Our providers are mobile. Do we need to give them tablets, docking stations for PCs? Are they going to be accessing their EHR on their smartphones? You need to take in consideration where that information is going to be retrieved and where data entry is going to be put in by the providers, and then look at that organization. Your EHR may have a platform that exists not only on an iPad and Apple OS, as well as a PC OS. Understand that. Apple operating systems are very hard to support remotely, so recognize that that may be something you need to have a plan of action in place for. Same thing with your clinical staff. I mentioned earlier, are you going to interface your new EHR with any type of diagnostic equipment, like I said, pulse oximetry, vitals machines, any type of that information that you would need to have maybe a fixed device or a device that had Bluetooth on it. I tend to see in our 10 years of deploying these products that the clinical staff is more apt to a tablet type of entry device, because they're doing more subjective data entry. They're keying in vital signs or answering questions about medical history, things along those lines, maybe updating medical lists. So it's very point and click driven. The providers tend to be more text driven, whether it's voice recognition or creating sentences and paragraphs through point and click. So we tend to like a bigger user interface, potentially a wall-mounted workstation. So again, providers and their staff through the workflow in preparation for this new EHR and understand what type of hardware you may need to upgrade or buy new. I also mentioned that with admin and finance, practice in. You're going to be doing faxing, scanning, and printing things that are come out of this new EHR. So ensure that you have the proper hardware. If your EHR has a PM system embedded in, it may be time to look at getting our billing team larger monitors from looking at smaller monitors in the past, because there's much more information in front of them at this point. So this is, the network and the computing hardware are very important to ensure a successful user experience with this new EHR. Dustin? And finally, who ensures all this technology is going to work outside of your EHR vendor? Is it your staff that you can call if your connectivity's down or you can't print somewhere? Probably not. Your EHR vendor? Most EHR vendors are dedicated to that application support, not necessarily the network. Your nephew, your friend from church, I would highly suggest that it's time to move to a managed service provider, someone who professionally manages the IT, the network, and can provide you with the HIPAA and security risk analysis tools that you'll need moving forward with meaningful use and some other government mandates. So as you look at managed service vendors, obviously there's costs involved with that. You want to look at if they're going to be on-site or remote support. What is the monthly cost? Is it per device? And then obviously get some referrals. But as you move to a new EHR platform, everyone gets very focused on the features and benefits and functionality of the EHR. I want everyone to look at their practice, their network, their hardware, and their connectivity, and who's going to support all that to ensure that new EHR vendor can do the job they want to do. So with that, I'm going to transition on. Thank you, Dustin. Thank you, everyone.
Steve, thank you very, very much for the overview on infrastructure. Very detailed, much appreciated. So now we'll move over to Richard Sweeney from athenahealth. Richard, thank you so much for covering the conversion needs today.
My pleasure. Thank you, Dustin. So as I go through here and talk about some of the conversion needs, and some of the questions that you should be asking yourself, behind the scenes, you'll notice that a lot of these kind of overlap with the infrastructure. And the reason why in choosing an actual vendor, the topic that we're going to talk through here, there's going to be some overlap, because all of these are very important areas and topics that need to be covered and need to be thought of from multiple different levels within your organization. The first one, we're going to talk about the hardware requirements. And Dustin, if you can go to the next slide, that'd be great. So for the hardware requirements, you're going to want to know what are the requirements as your system is on today, and what are the requirements to the system that you're going to potentially be moving to or that you're evaluating. Is there specific hardware requirement for the PC? Is there limitations when it relates to if it's a web-based application? Is there a specific browser? Do you need to have a server within your office? Do you need to have a certain internet speed within your office? These are all of some of the things that you really want to think about from when you're moving from one vendor to another vendor, to ensure that although maybe you've transitioned onto electronic healthcare record a year ago, that one particular vendor, although there's information and all the hardware requirements that you had, are going to be probably very different from what the next vendor is that you're going to be moving on to, whether it be from the PC level to the actual physical, computers, or the actual browsers that you need to actually utilize to leverage and access all of your patient information. Dustin? Next component is the data. So one of the most challenging aspects of healthcare record to another one is your data, and quite frankly, it's the most important aspect. This is the sensitive information, all of the HPI that you have stored, whether it be locally on your servers or in the cloud, where all of your patient information resides. You really need to understand when you're transitioning what information needs to be converted, what is absolutely necessary to bring over, and what the system looks like, what the information looks like in a system today, and what is it going to look like in a system going forward. So, one of the biggest, first and foremost, is you really want to understand how that information is going to be provided back to you from your current vendor. Is it going to be coming back to you in an image type format, and maybe demographics in, you know, a text format or an Excel type of format? Is it going to be coming back into discrete data that you're going to be able to import into the next system? All of that is very important information because, unfortunately, you know, picking up and moving from one system to another system, it's not a one-size-fits-all, and some information very well can be transferred over, but there's some restrictions also with some information that might not be able to. So when you're thinking about this, you kind of can break it down into a couple of different categories. Clearly, you know, there's the practice management data, and then you have the clinical data and information. You know, the practice management is typically, you know, demographic information as it relates to, you know, patient address, first name, last name, phone number, date of birth, all of that information. Most vendors today have little problems exporting that and getting it into a usable text format to import into the next vendor. Clinical data and clinical information sometimes can present a little bit more of challenges. Depending upon how you want that data and information in what format, will really be dependent upon how much or how little you'll be able to bring in. So if you want clinical data to come over into a structured format and to, you know, backfill and pre-populate into the next system that you move on to, while possible, might be a little bit more challenging. If you're more concerned about just having access to those images and documents and getting them into your system, that's probably a little bit more feasible. Or the other question is, do you even want or need this information to go into the next system? Or do you have a secondary storage device or a plan in place that you're going to keep all that information in, you know, outside of the new EMR, and you can always refer back to it? That's an option. While maybe not ideal, it's definitely an option. Okay, next, Dustin. Then one of the things to consider about when you're going through a conversion is the third-party connectivity. You know, being a medical practice, you have extensive connectivity with several different stakeholders within the industry, whether it be your pharmacy, your labs, you know, the radiology imaging center down the street, whether it be other hospitals or payers or in-office equipment or clearinghouses. You need to ensure that you can maintain connected to all of these parties. And it's important that you understand if there's cost associated with maintaining connectivity with these. You know, is there a cost to build integration to the hospital lab? Is there a cost for clearinghouse fees? You know, is there a cost for interfacing to you know, a lab system that you might have actually in your office? So all of these things are things that you want to think about. Also, you're going to want to think about, as these third parties do change, or as there are upgrades on their end, what can you expect from them? Say, for example, if you have an in-house lab, if you have an in-house laboratory system, what if they upgrade or update that software? How does that impact the integration with your electronic health record? So these are just some of the things that you'll kind of want to think about. You know, think about all of the machines and all of the connectivity that you have and how it's going to connect, and if there are any costs or fees that might potentially be associated with it. Okay, Dustin. So next one is training. Training is important. Training is up there with one of the most highly ranked points in any conversion from one system to another system. These systems are complex, and there's a lot to learn. And one of the ways that a practice will thrive on these systems is ensuring that they embrace it from the beginning. So, understanding how each of your staff member will be impacted by this change, making sure that you're coming up with a training plan for each and every one of your employees. How is it going to affect the people at the front desk? How is it going to affect the medical assistants? How is it going to affect the office manager, the clinical manager? How is it going to affect the physicians? And one of the important things is making sure that although it's work transitioning from one system to another system, it's very important that that work actually gets put in to ensure that you know how to fully leverage the benefits that that system offers. One of the other areas is that not only prior to your going live on a new system or a new EHR, it's even after the fact. You might find that you might have a new front desk individual join your office a year after you've been on the system. Or you might have a new doctor come in 2 years down the road and they need to be trained on it. So you also want to know and understand, with that vendor, how much access to the trainings do you have, and what's the kind of support that that vendor provides to you to ensure that every single one of your staff members, regardless of roles or responsibilities, can be brought up to speed, regardless of when you actually went live on the system or not. Then our last point here is the industry requirements. When you're converting, industry requirements, quite frankly, is a big reason why some vendors actually have, or some practices have actually chosen to switch vendors. Meaningful use several years ago when it was first introduced, there's some vendors out there that aren't able to support meaningful use or industry changes similar to those. Some of the industry requirements that you want to think of and ask of your vendor and see how they're going to be prepared is, are you ready for ICD-10? Are you ready for meaningful use stage 2 and whatever changes might be coming up down the pike? Not only are you ready for ICD-10, but what was your plan like? What did you actually do to prepare for ICD-10? Do you have any testing that you've actually done with all of the payers to ensure that you are successfully able to transmit information back and forth when this industry change actually takes place? So, and these are just some of the known changes. You're also going to want a vendor that's forward-thinking, that's also going to be able to be nimble and react to when industry changes happen. Some might come about more quickly than others, and by being able to adapt to those in a rapid fashion is equally as important to these longer industry requirements that have been out there for a little bit longer time. So that concludes my portion. I will hand it back to Dustin to go on to the next portion.
Richard, thank you so much, and thanks for all the detail regarding the conversion needs. I'd like to introduce Mark Roberts with Vermetis. Mark will be covering the portion to kind of tie this all in with choosing a vendor. Welcome, Mark.
Thank you, Dustin. Welcome, everybody. I'm going to touch on replacement drivers real quickly, acquisitions and mergers, physician and clinical satisfaction, compliance issues, and cost. If you would, Justin. Hospital systems, as many of you know, are buying ambulatory groups. Here in Phoenix, we look no further than Banner as a wonderful example of that. They're in 14 states, and they're buying ambulatory groups as fast as they can get their hands on them. Payers are buying health systems. Look at United Healthcare's profits these days. They're buying health systems as quick as they can. And, of course, healthcare vendors are merging as well. Everybody's probably seen the headlines when Cerner bought Siemens. And so a lot of changes are taking place in our industry as a result of these acquisitions and mergers, and they're happening quite quickly right now. Dustin, if you would. Clinical satisfaction is probably one of the biggest drivers, but I think there's a couple things to keep in mind here. Physician and clinical user complaints are valid, but I think depending on the size of your organization, you need to take those and drill down on what's driving that dissatisfaction. If you're a 2-doctor group and both physicians are struggling with their EHR and struggling with their EHR vendor, you might find that's a good reason to make a change. But if you're a 22-doctor group and 2 of the physicians are unhappy, you might want to drive down to looking at things like productivity as a driver instead of satisfaction. In doing this since 1984, I can probably tell you that most of the time, most clients are dissatisfied with their vendor and their support and their training, as Steve and Richard pointed out. Good training and good support can solve most of these problems. I think it's important to note in our business today that most vendors are developing to the beat of the government regulations as opposed to enhancement requests and innovations like we were some years back. Dustin? Compliance. Compliance is a good reason to switch. Unless you're opting out of meaningful use, you need to be absolutely sure your vendor of choice is CMS ONC certified. You can't opt out of ICD-10, so that becomes an even more important driver in your decision process. Make sure, and I just want to follow up on what Steve said about when you are converting your legacy data, make sure you still have access to it. There are stories, and some of them are true, that vendors have gotten rid of their old systems. Practices have gotten rid of their old systems and then got a CMS audit letter and were unable to verify what they did, and CMS recouped the $18,000 a doctor they took from them. So again, be very careful about that. The other thing you might also find interesting, under meaningful use stage 1, there were 472 vendors that were certified. For stage 2, MU2, less than half that number made the grade. Meaningful use 3 is coming up in 2017. I wonder how many vendors will be ready for that. Think about that as you look at this. Dustin? Remember, your practice is a business, and it's a business with a budget. Make absolutely sure that you've identified all the costs involved in changing systems, because there's a lot of it, and Steve and Richard both touched on most of them. The acquisition model that you choose is going to change your cost structure, and it's probably important to note that there are several acquisition models you might pick from, as again has been covered already, but subscription models, purchase models, revenue cycle management models where you get a free EHR system in exchange for a certain percentage of your collections. San Diego, we have health systems that are subsidizing the purchase of some systems. And last but not least is free. And free is truly never free. So those are all things you want to make sure that you think about as you approach choosing a vendor for the second time around. Dustin? Try, if you would, to keep these questions in mind as you work your way through this process. Hardware, software, data conversion, all these things play a role in what you're doing. Make sure you understand what your goals are, what the biggest benefit of changing is, the biggest drawback of changing. How much is it going to cost to stay, and how much is it going to cost to switch? Keep those questions on the tip of your tongue the entire time you're searching your vendors, and then you'll find you make hopefully a better decision the second time around. That's all I've got.
Mark, thank you very much for covering all the important notes on choosing a vendor and going through the switch process. So now, if there's any questions from any of the attendees, you can go ahead and type them into the GoTo webinar panel. It's definitely a great opportunity to ask questions, as we have all 3 vendors here present on the line and ready to give some quality feedback. I would like to note here the regulations and the compliance portion of this. All of you had touched on that, it really becomes a concern. And Mark, you mentioned half approximately are qualifying for MU2 and what MU3 looks like. It's kind of it's a concern, is it not?
Absolutely. It's, your vendor choice gets thinner and thinner as we move forward through this process.
While we let any potential questions come in here, I'm going to go ahead and show the poll results that we did early on in the webinar. So let's go ahead and show those here. We'll go with the first one. So here we go. How long has your practice been using an EHR? 75% said 3+ years, 25% said 1 to 3 years, and 0% in the last 12 months. We'll go ahead and move to the next one. Are you considering switching your current EHR? We have half saying yes at 50% and 25% saying no, and the other 25% undecided with I don't know. All right, we'll move to the last one. How confident are you with your vendor's readiness for industry changes? And I think this kind of loops around to what we were just talking about, Mark. We've got a third that are concerned and about 2/3 that are somewhat confident, but nobody really leaning towards the very confident or confident realm of things. So the MU2 and the ICD-10, very, very important topics, and it looks like there is some type of concern out there within the practices.
I think it boils down to your vendor choices again.
Well, I'd like to thank all three of you gentlemen. We don't have any questions that have rolled in from the attendees yet. I'd like to show their information here, the contact information for Steve, Mark, and Richard. These slides will be sent out to everybody, so you'll have this information to look over again. If you have any questions for any of the individual presenters, you can definitely reach out and contact them directly by email or phone. This webinar has been recorded, so we'll master this over the next week or so and have this up on the PRC website. So any other final comments from any of you gentlemen?
No, thank you, Dustin, for the opportunity to work with the team there.
Thank you, everybody.
Yeah, thank you. Thank you very much to Steve, Mark, and Richard. We greatly appreciate it. And everybody have a wonderful day. Thank you very much.
Thanks.
Thank you.